Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Najana Bila binti Zaidun and my matrix number is 2020165545. Today, I would like to discuss about our report topic, which is workers must be protected with a safe and health work environment. In 2020, the world has shocked us with a virus that we call as COVID-19, and it really gives a bad impact towards people in all sectors. As we know, COVID-19 virus is dangerous and it can kill all of us if we did not take care of ourselves. Workplace safety is important and must be our priority to avoid any injury or death at the workplace. During this pandemic, the risk of workers to get an infection is high, mostly health worker and frontliner. The virus is easily spread between people and raising the risk of infection among these important workers with whom they make contact. Besides, health worker plays a vital role to save the patient who infected by COVID-19, even though they risk their life to save the patient. Health workers have a high risk to get infected while doing their job due to exposure to COVID-19 patient, but it can be protected by strict rules to establish infection prevention and control measures. Not only health workers that face a high risk to get infected by COVID-19 virus, but to particular sectors that have a crowded place, close contact settings, and confined enclosed space workplace. That is why workers must be well protected with a safe and health work environment. Malaysia already taking a step to strengthen their national OSH system and providing the safe places for the workers and give a vaccination to prevent the virus. Lastly, COVID-19 virus show us the importance of cooperation between government, employer and workers to prevent this virus. Employees need to be protected by paying attention such as training them on risk assessment and risk control measures. They must follow standard operating procedures, which is SOPs and guidelines to prevent the spread of COVID-19 that have been set for the country, such as keeping a distance of 2 meters, always wear a mask, always in good health when entering work, and so on.
Hello, Assalamualaikum. My name is Nur Adila Natasha binti Azman. My matric class number is 2020706795. In this video, I want to share with you the issue of the article that we choose, which is workers must be protected with a safe and health work environment. The spread of this COVID-19 has created major issues for existing organizations all around the world, especially towards human resource management, as this significantly impacts working conditions. The concern issue of human resource management during this ongoing pandemic is about a safe and healthy work environment. Workplaces with high level of COVID-19 risk, such as health and social care facilities, have been disproportionately affected. Direct contact with COVID-19 patients puts healthcare workers and other frontline medical staff at risk, but they can be protected by strictly following infection prevention and control procedures. Moreover, human resources management had to deal with serious issues in the workplace concerning the pandemic when it comes to identifying the risk factor and implementing the most appropriate preventive measures for the specific situation to ensure the safety and health of the employees. In combination with the efforts of the manager or human resource management practitioners enhancing training and capacity building, assessing risks and controlling them, health and welfare measures as well as national operational procedures and policies are needed to prevent the spread of COVID-19. Despite the COVID-19 pandemic in Southeast Asia, many countries stepped forward their occupational health and safety system, such as Malaysia's Ministry of International Trade and Industry aims to provide employees with a safe and healthy working and living environment while reducing the spread of COVID-19 in the country.
Assalamualaikum, my name is Marzatul Izzati binti Hasrul Nizam. My student ID is 2020325189 from class BA119. For our method discuss that we have agreed some occupational sector are at high risk of being exposed to COVID-19 infection. The environment of the workplace is characterized by 3C, which means crowded place, close contact setting, and confined and enclosed space. For example, cases in Malaysia, mostly cluster spreading fast in the manufacturing and construction sector because the workplace has many people that make the place crowded and the virus easily infectious more people. There also has some place where can occur of new cluster other than workplace. It can because of the accommodation standard and living and working environment. Furthermore, there are some employers who refuse to stop operating. Non-compliance of the employer to comply with the condition of the movement control order resulted in the safety and health of the employees not being maintained. It is also a failure to control the cluster from spreading and make the daily cases increase. This action of the employers is not supposed to do to their employees. The employee safety and health need to be protected like their physical and mental condition. Especially in this COVID-19 pandemic, some of them must have problem from their income to support the family. Matter need to be disputed and taken seriously in order to safeguard the human right of fellow human being like moral aspect, legal aspect and economic aspect. Moreover, ILO make the work environment a central issue that is related to protecting workers from diseases, sickness and injury. Since ILO and WHO want to support the government, they have joined force to achieve the goal together. They propose to build resilience of how to face the COVID-19 pandemic, also for the future crisis. Hence, the safety and health of occupational standard can be improving to be more relevant in the future.
Assalamualaikum and hi. My name is Nur Shazlana binti Zahari. I'm from BA 119-4B. We also agree with this article that COVID-19 pandemic has highlighted the significance of social interactions between government, employers and workers group. Not only reacting to disasters but also in fostering an excellent occupational safety and health conditions. This is because the government is responsible for ensuring the safety of the people, including the workers. Therefore, an SOP has been created to prevent the spread of pandemics at the workplace. One of the SOP is that only 40 to 60% of the numbers of the workers can attend to the workplace according to their respective state phases. In addition, the recommendations of work from home are also strongly encouraged to curb the infections from spreading. Hence, employees and employers need to adapt the SOP set by the government so that their business continue to run as usual despite of the shortage in terms of manpower and so on. Besides, particular attention should indeed be given to ensure that the plans and strategy will not discriminate against any of the parties involved. There should also be given priority regardless of the gender, ability and others to enable each of these individuals to still be able to support themselves or their families even if the country is in a pandemic. Therefore, the welfare of employers will remain secure without any problems. Thus, they will be able to further expand their business in the future.
Assalamualaikum and hi madam. My name is Nurlisa Irina and my student ID is 2019-667-102. In this video, I'm going to give some suggestions on how to maintain occupational safety and health, or also known as OSH. The first measure is that all workplaces must carry out worker screening on a daily basis. As for example, employees must check their body temperature before they enter their working site. Next, they must be vaccinated before entry to the workplace. Moreover, those who are infected by COVID-19 may exhibit no signs or symptoms, so employers should continue to follow the regulations of wearing face coverings, basic hygiene, and physical separation.
There is no exception for anyone, which means that worker screening protocols must be applied consistently without regarding to race, national origin, sex, age, handicap, or other protected characteristics. Secondly, suspected cases should then be identified and isolated. So, what should be done? The first step is keep infectious people out of the office as much as possible. Next, employers should set up a method for employees to report if they are sick or have COVID-19 symptoms. If a worker develops COVID-19 signs or symptoms at work, get medical attention as soon as possible. Thirdly, working from home is one of the tactics for avoiding large groups of people congregating in one location. Since COVID-19 disease is rapidly spreading, most employees would feel insecure at work until everyone else was fully vaccinated. Furthermore, employees who work from home are more productive and less stressed. This has resulted in a significant increase in employee demand for hybrid or remote work solutions.